Hello, everyone. I'm Dr. Marty Ross, and tonight is another conversation with Marty Ross MD. So as you know, this is a webinar where we're going to talk about Lyme disease. I always look forward to seeing what you have in store with me because your questions create these webinars, basically. I'm glad to see that we have a number of new people here, and also there's quite a few returning people as well, too. For those of you returning, I'm glad to see you keep getting some value out of this. For all of you, the way that you participate in these webinars is a couple ways. Number one, you can see what questions other people have and how I respond to those questions when I take them. Okay, so that's number one. Second way is to go ahead and actually write a question to me. If you choose to write a question to me, if you go bold and write a question to me, use the chat box on your screen. And you'll notice you have two options there. There's something that looks like two chat windows, and there's another icon that looks like a question mark. Use the one that looks like two chat windows, okay? That's the icon that works better. I prefer to take the questions in that chat function rather than the Q&A only or question mark function, okay? So please write them in the chat function, not the Q&A function, all right? All right, so while you're participating in the webinar tonight, if you're in the live version, you'll actually be able to see the questions as I read them, because in the live version, they actually show up on your screen. I will read them out loud, though, because in the recorded version, people don't get to see the screen the way you do, okay? All right. So this is our second webinar of May. At this point, I hadn't had one scheduled for next week because I was supposed to be out of town. But it looks like I am going to be back in time. I will be back on a Wednesday evening late rather than Thursday evening. So I should be able to go ahead and do that. And so tomorrow morning, you will get an email from me announcing that the recording for tonight is ready. So yes, I am creating a recording as usual, as I usually do. And you'll get an email from me in the morning that has a summary of what we talked about, as well as links to the recording. And in addition, you can sign up for the next webinar as well, too. And there will be one next week. Okay. All right. And then, okay, now what I got there. Well, that must have been my protein smoothie. Sorry about that. I couldn't tell whether I had nicked myself shaving or whether it was food, but it looks like it was food. So glad I got rid of that there. Anyhow, so you'll have a chance to sign up for the next webinar next week then. Okay. All right. So one other thing I'll ask, when you get the emails tomorrow morning, share them with other people you think may benefit from either those that could participate in our webinar. No, it caused bleeding there. I was like, I'm going to just have a mess here tonight. Anyhow, I guess I better stop fussing with that. Anyhow, let's go ahead and take our first question here. Okay. All right. Let's see here. There you go. Hello, Sarah. Let's see. Hello, Marty. I did IGenex Immunoblot testing, and all that came back was indeterminate for band 23 IgM and indeterminate for band 23 and positive 41 for IgG. What does this mean? Do I have Lyme? Also got an indeterminate for Bartonella species and Bartonella genus IgG. I'm very confused on these results because all the different strains of Bartonella are saying negative for Elizabethii, Vinsoni, Henseli, and Quintana. Okay, all right. Let me try to make some sense out of this. So let me explain how the Immunoblot method is done first, okay? And then we'll talk about how do you interpret that too. Oops. I think I created a mess here. Anyhow, all right. So the way that the Immunoblot is done is IGenex basically takes proteins that are found on the covering of the Borrelia germs for Lyme and on the covering of the Bartonella germs for Bartonella, okay? And they grow these proteins in the lab in bacteria, actually, different bacteria. So these are proteins produced in the lab. Now, the reason that they want to go ahead and do that is they're producing cleaned up proteins, because what we're trying to see is, do you have antibodies that attach to these proteins, all right? And if you do have antibodies that attach to a certain pattern of the proteins, we call that a positive test. The reason we grow them in the lab like this is we want to make sure they're cleaned up versions of the proteins. And basically what we do to clean them up is we remove amino acid or protein sequences within these proteins that might falsely or wrongly attract antibodies that were actually made against another infection, like a virus infection. Okay, so we grow these proteins that were originally found on these germs. We regrow them in the lab so that we are sure that when antibodies are attached to them, they really were made against Bartonella, or in one of your cases here, against Borrelia. Okay, so that's one reason it's a good test, is that the chances of getting a false positive test are actually quite small. Okay, all right. Number two, with the Borrelia and the Bartonella, one of the reasons that the IGenex method is better than other ones out there is they test for more strains of the germ. So specifically with Borrelia, the IGenex method is looking to see if you have antibodies against 8 different kinds of Borrelia, and they'll actually can list that. And so when you get a test back, it says positive. It doesn't actually identify which of the 8 strains, but within their mix are antibodies against the 8 strains, or proteins against the 8 strains. Okay. Now on the Bartonella side, what they do is they test to see if you have antibodies against proteins found on 4 specific strains, which is the Elizabethii, the Vinsone, the Henselae, and the Cantana that you're talking about here. And in addition, they're looking to see if you have antibodies against the species, okay, or the family. So the thing about Bartonella, we think that there's 15 strains of Bartonella that can infect people. And we only have testing that's good at identifying 4 of those 15 strains. But we do have good testing that identifies whether you got an infection from the family. All right. So if your 4 strain tests come back negative, but the family test comes back indeterminate, that will get you an indeterminate test. All right. So yes, you could be negative against these 4 specific strains and have an indeterminate showing up on the genus test, which means you may have something from one of the other 11 strains. Okay, basically. All right. Now, the way that you interpret an IGenex Immunoblot, how you determine if something is positive, is we are specifically looking at whether you have antibodies against a potential of 6 different proteins. Okay. And those 6 proteins we identify by what they weigh, or they're called a band. All right. So there's a band 93, for instance. But the 6 proteins that we look at are 23-25, 31, 34, 39, 41, and 93. And generally, most of us will interpret that a test is positive if you have antibodies against at least 2 of those 6 proteins. All right. So on your IgM, you had an indeterminate only against band 23, but you didn't have anything else showing up there. And your IgG came back positive at 41 and indeterminate at 93. Now, you might interpret your Borrelia test as being indeterminate leading positive. All right. And here's what I mean by that. If that 93 was not being reported as indeterminate, but rather was being reported as positive, that coupled with your 41 on the IgG would be a positive test. Okay. Now, you can get an indeterminate test for a couple reasons. One is it's a test artifact. There's dirt that shows up on the test strip. All right. But the other reason you can get an indeterminate at one of these protein positions is that due to immune suppression caused by the infections, your body may not be able to make enough antibodies or a large amount of antibodies, so the testing has a hard time seeing it, basically. All right. So when I get back a test like this where you got an indeterminate with 1 positive at those 6 important proteins, I really want to know more about what your symptoms are. I want to know, do you have enough symptoms that look like this could be Lyme? And if you do have enough symptoms that look like it could be Lyme, I might interpret the test as being a positive test, even though it's not technically by IGenex standards. But if there's enough symptoms there that say, yep, Lyme, and then you've got an indeterminate 93 here and a 41, those are 2 of the 6 important ones. that indeterminate, again, if you got bad enough Lyme, sometimes you get suppression, so you just can't make enough antibodies. So it might be able to interpret as weakly positive. Okay. All right. I hope that gives you some insights there. Good luck to you, Sarah. Peggy says, hi, Dr. Ross. Hello, Peggy. Glad to see you here. Hello, T. Lee. Let's see. Can you please discuss the relationship between Lyme disease and Hashimoto's? I understand that many people who have Lyme also develop Hashimoto's. I was diagnosed with Lyme in 2020 with symptoms and a positive Lyme blood test. Years earlier, I was diagnosed with Hashimoto's following symptoms that were remarkably similar to my Lyme symptoms. My PCP ran Lyme blood test at that time, as well as thyroid test. Could I have developed thyroid antibodies prior to developing Lyme antibodies, and as a consequence received a false negative on the Lyme test? My thyroid peroxidase antibody has improved, but still above reference line. My thyroid globulin antibody has significantly worsened and is now almost 10 times above the reference line. Thanks so much for these chat sessions. Okay, so there's two possibilities here. Okay, so Hashimoto's, which is an autoimmune illness. It's an illness where your immune system starts attacking the thyroid, basically, right? And because of that, you get thyroid dysfunction. All right. Now, the question is Lyme a cause of those antibodies? Did Lyme trigger an autoimmune illness triggering the Hashimoto's, or are they two separate illnesses? All right. So it is possible that for some, when they get Lyme, that it actually triggers autoimmune illnesses, of which one of those can be Hashimoto's. Okay. It is also possible that you could have two separate illnesses. You could have Lyme, and independent of Lyme, having nothing to do with Lyme, you could have Hashimoto's. And the trouble is, we have no way of knowing. We have no way of knowing for sure. Okay, now, what I will tell you is your initial test for Lyme, I understand it came back negative, but it all depends on how good of a test it was. So if your initial Lyme test was done using IGenex, I don't know how long ago your first test was done. So their Immunoblot test, which came out a few years ago, it will find Lyme about 95% of the time when it's there. Okay. Their old Western blot test that they used to do would find Lyme if it's there about 75 to 80% of the time. If you had testing done through the regular lab system, like a Lab Corp, PacLab, they would have been using a test kit from that's approved by the Food and Drug Administration using standards of the Centers for Disease Control. That testing method, which is called a two-step test, will only find Lyme if it's present about 60% of the time. Okay, so it is possible that you may have had testing that just missed the original Lyme, and it might have been Lyme, especially if it had a lot of symptoms suggesting Lyme back at that time too. Okay, all right. Now, again, you can't tell for sure whether it is Lyme or they're two separate illnesses, but yes, in some people, it is due to Lyme. And often what you find, if it is due to Lyme, is as you clear Lyme and the co-infections, the immune system often can start working well enough and the Hashimoto's will go away. Okay, all right. There are some other things I like to do when I have a patient of mine that has Hashimoto's and has Lyme, regardless of whether I think it's Lyme that triggered it or it just happened, okay? And that is what I like to do is put them on something called low-dose naltrexone. So naltrexone is at full strength is something we use as a narcotic blocker and can actually be used to treat alcoholics as well too. And it binds to a receptor in our body called an endorphin receptor, all right? Now, endorphins are our natural pain chemicals, and but they also are used to regulate the immune system. And what happens when you use low-dose naltrexone, it binds to these endorphin receptors, and it makes them super sensitive to any endorphins that are out there during the period that they're bound up. And also during the period they're bound up, the brain doesn't like it, and it sends out a bunch of signals and tells the endorphin-producing cells in the body to make more endorphins. So at about 4 to 6 hours, when the naltrexone wears away from these endorphin receptors. They get flooded by all these extra endorphins, and these receptors are now super sensitized, okay? And what this can do is it can rebalance the immune system away from being autoimmune oriented, with illness oriented, which would be something called Th1 inflammation, more towards the direction of fighting illness, which is called Th1 predominant, okay? And probably the way that it does that is it causes alterations in a type of cell called a T regulatory cell, which is a type of white blood cell that's supposed to regulate what happens with the germs that fight infections under Th1 and what happens with the immune cells that deal with allergies and autoimmune illness that occur under Th2. All right, so the Treg is the parent in the room balancing these levels. When you have autoimmune illness, usually you have too much Th2, which leads to suppression of your germ fighting abilities. And if you use LDN, it can help the Tregs work better to get these two back in balance. So you have less autoimmune illness and you have better germ fighting that occurs with your Th1 side of the inflammation system. All right. All right. So I have a whole article on that. Let me go ahead and show that to you. All right, so this is my Lyme information site, and there's a couple articles I have you take a look at, or other if people want more information. So take a look in my immune system section here. And for information about low-dose naltrexone, how do you use it? How do you start it? How long to use it? Take a look at this article here called Low-Dose Naltrexone, LDN, and Lyme, okay? And then for more information about thyroid illness and the things you would do in addition to LDN to help with thyroid illness, Hashimoto's thyroid illness, take a look under my hormone section here. And there's an article called, this one here called It's Tricky, How to Diagnose and Treat Low Thyroid. Okay, all right. But this goes through also goes through testing and why there's a better way to test than what standard doctors would do, rely more on functional medicine. Thyroid testing is more comprehensive than standard doctors, all right? There's nutrients you can take, and I review all that in here as well too, okay? All right. Good luck to you. Thanks for the question. Hello, Nate. Let's see. What's the recourse for a bad bout of Lyme, meningitis, Herx? So I think I'm trying to interpret what you mean by your question. I assume that you probably have meningitis, and I'm probably thinking it's more immune related, or maybe even due to the Lyme infection itself. And you're wondering what to do about that Herx reaction. All right. So a Herxheimer reaction, everyone, let me talk about that first. And then Nate, I'll talk to you about ways that you can go about this. All right. So to talk about Herx reaction, I have to talk about something called cytokines. And cytokines are inflammation, a group of inflammation chemicals that are made by your white blood cells. And they're good and bad. All right. So whenever you get an infection or you have a toxin floating around in you, your immune system is going to want to deal with that problem, get rid of it. And there's a certain type of white blood cells that will see the problem, and then they want to turn on the rest of the immune system to deal with that problem, okay? And so what they make to turn the immune system on are cytokines, all right? So cytokines are good in the sense that they're signaling chemicals that are supposed to tell the immune system to make more white blood cells, bring those white cells to where the problem is, and help those white blood cells work better. All right, that's good, all right? Now, when you get certain conditions like COVID or tick-borne infections or chronic mold toxicity or even chronic yeast overgrowth in the intestines, what happens is the immune system tries to deal with those problems, and it doesn't do a great job sometimes. And so it keeps trying harder and harder. And the way it keeps trying harder and harder is it starts making more and more cytokines, all right? And so quickly, those excess cytokines give you the majority of what we call Lyme symptoms. So they give you pain in your neck, like meningitis, for instance, okay? Or they can give you headaches, or they can give you trouble sleeping, or they can give you fatigue, or they can give you brain dysfunction where you can't think clearly, or they can give you joint pain and muscle pains, or they can interfere with your hormonal systems, resulting in low thyroid, for instance, okay? So the majority of the symptoms we have from having tick-borne infections or mold toxicity or chronic yeast are actually excess cytokine symptoms, all right? All right. Now, when you start killing germs, what happens is the immune system sees these dead bug parts, including the proteins that get released from killing the germs and the toxins that get released from killing the germs, and it reacts by making more cytokines, all right? So you get worsened inflammation, you get worsened thinking, you get worsened energy, you feel fluish, you might even get temperature spikes. That's because of cytokine excess. So the quickest thing to do is to get those cytokines knocked down. And there's a couple of things I like to do. Number one, I like to work. So cytokines, again, are manufactured in white blood cells. Okay. So think of white blood cells as the cytokine factory. All right. And for the cytokine factory to make these cytokines, it has to receive a message telling them, make the cytokines. Well, the messages that these white blood cells send to each other are basically oxidation agents, oxidizing agents. Okay. So the oxidation agents hit these white blood cells and they say, aha, let's make cytokines. All right. So one of the things I like to do is interfere with the factory. Second thing I like to do is block the message. Okay. All right. So to interfere with the factory, to get inside the factory and interfere with production, I like using curcumin. Curcumin is a component of the seasoning turmeric. And if you have it in sufficient quantities and in a way that it's made to be absorbed, it gets inside those white blood cells and can block the cytokine production line. All right. And the product I like for that is a product made by Th1 called Mariva, or actually used to be called Mariva 500. It's now called curcumin phytosome. It's a 500 milligram pill. For mild herxes, I might do 500 milligrams 3 times a day, which is 1 pill 3 times a day. For severe herxes, I would probably go up to 1,000 milligrams, which is 2 pills 3 times a day. Okay. All right. Number 2. To lower these oxidation agents that are telling the white blood cells to make cytokines, you use something called glutathione. So glutathione is an extremely powerful antioxidant that actually is manufactured in every one of our cells. And its job in every one of our cells is to repair damage. All right. And it's made in especially high amounts in the liver, where it also can help with detox too. So you can give it to lower the oxidation signals, and you give it to help clear the Lyme toxins out with the liver so there aren't as many around triggering cytokines. All right. All right. So you can do it orally. If you do it orally, you want to use a liposomal variety, which means it's microscopically wrapped in fat. That's what liposomal means. And that liposomal variety can be well absorbed. All right. Because generally, if you take it non-liposomal, it doesn't get absorbed that well. So the product I like for that is a product made by Research Nutritionals, which is called Trifortify. They have a different number of different varieties of it. They have a smaller tube, a big tube. They have it in individual packages. I'll show you where you can find that here in a minute. But usually what I'll have people do is take a teaspoonful or 1 packet twice a day when they're having severe herx. And then after that is over, you can dial it back to once a day. All right. Now, the strongest way to get your glutathione in if you're really having a desperate time would be to do intravenous glutathione. The trick is going to be finding somebody to do it, but you can get it so that you can give for severe herx. I might give up to 2,500 milligrams intravenously. Is given as something called an IV push. You put in a syringe, you put an IV line in, and over about 5 minutes, you just slowly push that glutathione in. And you can do that up to a couple times a week. Sometimes as you're starting out, rather than going to 2,500 milligrams, you might want to start at 1,250 milligrams to make sure you're going to handle it okay. All right. Now, if you cannot get the IV, you can also have it made in a form to be put in a nebulizer. A compounding pharmacy has to do that. And so there's ways to give it that way too. And I'll show you an article about that here in a minute. So the two things I would say to you is bump up curcumin all the way up to 1,000 milligrams 3 times a day is what I usually do in situations like this. And I would give oral glutathione for severe herxing all the way up to a teaspoonful or a packetful twice a day. And if that's not strong enough, I might jump up to either nebulized or intravenous glutathione. Okay. All right. Let me do a screen share here for you. Okay, so take a look at my Lyme guide and take a look at this section called Herxheimer and cytokines. And there's an article, there's two similar articles. I have one on how you control cytokines, and then there's one that I really just orient completely at what do you do for a bad Herxheimer reaction. That's this one here. And then in terms of the various ways you can use your glutathione, down here at the bottom, I talk about IV and nebulized glutathione as well too. Okay, all right. And then in terms of where do you get the curcumin and where do you get the glutathione I was talking about, you can take a look at my store. No one is obligated to buy from me, but I appreciate your business if you do. Basically, these are the products that I use with my patients in my practice in Seattle until I stopped clinical practice in May. But the majority of these are things that I was using at that time, and I found them to be effective. I've tried to do a good job of hunting out for quality brands that have a track record of putting in their product what they say is in the product, okay? In general, most supplements that are out there, brands that are not physician quality, are basically garbage. They've done studies showing that a lot of these manufacturers don't have in the product what is on the label, and they may even have extra things in the product that aren't on the label as well too. All right, so you got to be careful. I try to take that guesswork out of it for you so you can trust the products that I have here, and anyone can purchase from me. The other reasons to purchase from me is we fulfill our orders quickly. If you get that order in before 2 p.m. Central Standard Time, Monday to Friday, it will go out the same day. Okay. Number 2, I cover your taxes. Number 3, I offer free shipping if your orders are over $50. And finally, I sell my products at the lowest amounts allowed by the manufacturers. All right. So I welcome your business if you want to do that. So in terms of where do you get these products for cytokines, take a look at this is my store. I have a section here, which is by problem, and take a look down here at the Herxheimer die-off reaction section. And so here is the curcumin phytosome I was telling you about by Th1. And then here is one of the trifortified products. There's also other sizes of them down here as well too. Okay. All right. All right. Good luck to you, Nate. Rio said, well, I'll post what Rio says. So Rio says, hi, Dr. Ross and everyone in the chat room. This is my first time. Welcome here, Rio. Good to have you here. Let's see. Bear with me here. There's a bunch of people that were wondering if we're started yet. And we are. But those are still showing up here. Let me get rid of this. All right, here we go. Hello, Lenore. Let's see. Thank you, Dr. Ross. You're welcome. Let's see. I have been doing IV antibiotics for Lyme and co-infection since December 23. The doctor pulses antibiotics, and I don't think it worked with me. I have done these combinations, Rocephin, ertapenem, metronidazole for 6 weeks, followed by Rocephin, 4 grams, gentamicin, ciprofloxacin, methylene blue, then daptomycin, metronidazole, methylene blue for 6 weeks with pause. My symptoms at the beginning were severe brain fog, knee pain, joint pain, pain in the heels and bone of the feet, bloated and irritable bowel, frequent urination. My symptoms now are bone pain in the feet, heel pain, sole pain when I wake up, and knee pain, but less severe. I started my own treatment plan 4 weeks ago. I would like your suggestions as I'm noticing joint pain increasing in my hands and big toe. I am taking azithromycin, Plaquenil, cefuroxime, fluconazole, metronidazole. IGenex was positive, no other co-infections. All right. So bear with me. I just want to look at something here. All right, so your antibiotics generally are oriented at Borrelia, although from previous year IV, the gentamicin, Cipro, the gentamicin could be Borrelia, sometimes can help Bartonella. Metronidazole would be Borrelia. Methylene blue could be Borrelia or Bartonella. In other words, I'm just trying to tease out based on the antibiotics that were used for what infections you might have, all right? Because you didn't tell me that. But, and based on testing, you didn't tell me that. I know you've listed some symptoms here. So I assume based on some of your symptoms here, and again, I don't get to ask you a bunch of questions. I don't get to clarify what I really think you have, but based on some of the symptoms you've written here, as well as the mix of antibiotics that have been used before, I would suspect you probably have been treated for Borrelia and Bartonella. I would just assume that, okay? In terms of things that can sometimes be Bartonella, the frequent urination, some of the bone pain and feet pains, those can sometimes be Bartonella as long as a severe brain fog. The brain fog and some of the joint pains can also be Borrelia as well too, okay? All right, so in terms of your current prescriptions, the azithromycin, cefuroxime, metronidazole is going to be oriented at Borrelia in a growing, not persister state. Okay, and I'll try to say what I mean by that here in a minute. The combination of azithromycin, fluconazole may be a good Bartonella treatment as well too. All right. Now, both Lyme and Bartonella, we're starting to understand, have the ability to be in a growing state and in something we call hibernators, or we call those persister states. And so most of us, as we're treating those infections these days, want to make sure we're doing something to deal with persisters too. All right. Your old treatment with the methylene blue can treat growing and persister Lyme and growing and persister Bartonella. So you had yourself covered there. The daptomycin is part of protocols that have had some benefit for persister Borrelia as well too. All right. Now, the Plaquenil here is being used because it can make the azithromycin and maybe the metronidazole and fluconazole work a little stronger in the cells by changing the acid content of those cells. All right, that's what the Plaquenil is for. In terms of noticing joint pain increasing in your hands and your big toe, there's one thing that caught my attention initially here, and I'm just going to run it by you. So when I see somebody that's got a lot of bloating and irritable bowel type symptoms, I have to wonder if a other infection that a person has is if they also have too many yeast living in their intestines, all right? And so then you go ahead and you get put on all these antibiotics. That is even going to make too many yeast in the intestines even get worse, unfortunately, all right? So, and how that feeds into things here is, all these IV antibiotics you had could have been doing a good job taking care of Bartonella and Borrelia. But if you weren't doing better, you have to start wondering, well, why? Why weren't you doing that much better? All right. Was it because you were pulsing and not using it continuously? Or is there another underlying source of your increased cytokines? Okay. And if you have too many yeast living in your intestines, they can then lead to the immune system will see them and react by making too many cytokines. And again, as I explained earlier, it's too many cytokines that give you most of your symptoms. Okay. So one reason you may not have gotten much better in the IV protocol is you may just have yeast sitting there. Okay. And now that you're using oral antibiotics, the yeast might even be getting worse because you are on all these antibiotics. You are on one yeast killer here, fluconazole, but it just may be your system is just offset, out of balance enough because of the prescriptions that yeast are taking over. Okay. Well, taking over is a strong word, but growing aggressively in your intestines. Okay. So one thing that you should consider, and you probably ought to talk with your doc about, is do you have too many yeast? All right. So things to consider that might suggest that is you're not getting better, you're getting worse on an oral antibiotic protocol. Okay. Number two, do you have a lot of sugar cravings? Number three, do you still have a lot of intestinal gassiness and bloating? Number four, do you get repeat vaginal yeast infections? Number five, do you have problem with a lot of skin rashes, maybe pimples and acne? Where the pimples, acne, and skin rashes come in is that too many yeast release toxins that get absorbed into your bloodstream and will interact with the skin, leading to more pimples or acne, or leading to worsened psoriasis, may even trigger eczema as well too. All right. So if you say yes to a number of those things that I just said, I would be concerned about yeast. Okay. And what I would do in a situation like that is I might cut your treatment back a bit to try to focus on getting rid of the yeast, still while having you on things that would be useful for treating Lyme and Bartonella at the same time. So what I would do if you were my patient is if you say yes to a number of those yeast questions, I would look at paring back your treatment to azithromycin and fluconazole. All right, so azithromycin will treat spirochete Lyme and intracellular Lyme. Those are the forms of Lyme. All right. The fluconazole can pick up the cyst form of the germ, and together they treat the growing site of Lyme. All right. They don't do anything for the persisters, but the growing site of Lyme. Okay. The azithromycin and fluconazole also is a good Bartonella treatment. And the fluconazole, believe it or not, in there actually can treat growing persisting Bartonella as well too. All right. So you picked up your persisters by doing that. All right. All right. Then the other, and I would come off of, and again, you need to talk to your doctor about this. Okay. I'm just giving you my ideas, but I would, if you were to do that, I'd stop the Plaquenil, I'd stop the cefuroxime, I'd stop the metronidazole as well too. All right. Lighten up the load, give your gut a chance. Okay. All right. All right. In addition, and then that fluconazole you're on would be your main anti-yeast agent. And I would add another agent to that, which is nystatin. It's a 500,000 international unit pill. You take 2 pills twice a day, or you might add an herbal option, which is a product called Capri Plus. That's CAPRI, PLUS. It's got a number of antimicrobial herbs that can help against yeast, and you do 2 pills twice a day. All right. And then finally, to get at the persister side of Lyme and Bartonella, while you're on this pared back regimen of just azithromycin and fluconazole, you might consider adding in an herbal product, which is cinnamon, clove, oregano capsules. And there's a product specifically, which is called Liposomal cinnamon, clove, oregano essentials. And the reason I chose that to consider here is for 3 reasons, actually. Number one, it treats growing and persister Lyme. That's one reason. Number 2, it treats growing and persister Bartonella. That's the second reason. And number 3, those herbs in there, those oils, can be yeast as well too. Okay. All right. So those are just some thoughts I have for you. You might, if you start looking and you think, well, maybe there is yeast here based on what I was just saying. In that case, you would pair back to is azithromycin once a day, fluconazole 200 milligrams a day, add in nystatin as a 500,000 international unit pill as 2 pills twice a day. And then I would also consider the liposomal cinnamon, clove, oregano essentials, which would be useful at treating persister side of both of these infections and can help with yeast as well too. Okay. All right. I'm going to show you some things to look at here to give you more information. All right. Let's see here. All right, so take a look in my yeast section. There's a yeast chapter here. I have 2 articles that you may want to look at. One is how do you figure out if it's too many yeast? Okay. And number 2, what can you do about too many yeast? And as I said, I would suggest nystatin and fluconazole, and you might do the cinnamon, clove, oregano. Okay. All right. Then, in terms of that product, that cinnamon, clove, oregano, this is the cinnamon, clove, oregano product that I was just talking about. Okay. All right. All right, Lenore, good luck to you. So the one thing I just want to say, when I first see patients, I'm always trying to figure out what is the biggest thing that's giving the most problem, all right? And so somebody can come to see me and they can have solid history of a tick bite, positive testing for Lyme, Bartonella, and Babesia, for instance. But the first thing I always want to do at a first visit is figure out what's going on with their gut. Because if you are sitting there, even though you may have positive testing, you've got clear symptoms that suggest tick-borne infections, but you've got a lot of yeast in your gut, it's going to make it harder to turn around because your yeast is just going to keep causing the immune system pump out cytokines, okay? And I will also say there's a rare person that I have evaluated, and then I thought initially it's like, you got too many yeast in there, I want to put you on antibiotics yet. Let's just treat the yeast, even though you have positive testing, a lot of symptoms that look like tick-borne infections. And there's been a number of times that just clearing yeast got rid of all their symptoms. And we didn't even need to treat the tick-borne infections. It's very possible that when you have positive testing for tick-borne infections, because most of our testing is really looking at antibody reactions, all that our testing really says is you've got antibodies against those infections. It doesn't tell us whether the immune system did a good job and got rid of those infections on its own, which it can do. I mean, it's very possible that if you have a positive test, that your immune system may have gotten rid of it. And so the trick as a physician is to always say, yeah, you got a positive test for that, but could it be something else? Could it be something else that looks like Lyme, but it's not Lyme? And one of the biggest things is too many yeast in the intestines, all right? The second one, especially, and I should mention this to you too, if you're not getting better on all those antibiotics, you've got to start wondering, so there's 2 problems you have to wonder about. Number 1, yeast, because intestinal yeast overgrowth can create a syndrome that looks just like Lyme, Bartonella, and Babesia, okay? And mold toxicity. So if you are a person that breathes in mold toxins and cannot get rid of them, all those built up mold toxins that are in you can also trigger excess cytokines and would explain why on antibiotics you're not getting any better, and could even explain why you're getting worse if you happen to have mold toxicity and you're living in a building full of mold. All right. So you might also, unless you've done this already, you might want to talk with your physician about doing a screening test or urine test through a company called Real-Time Labs to see if you're one of those 25% of people that breathes in mold toxins from your environment that can't get rid of them. Okay. So the lab I like to do that is a lab called Real-Time Labs. Okay. All right. So those are two things to think about. All right. Good luck to you. Hello, Peggy. Let's see. I was tested for Lyme through IGenex, and it came back positive for Babesia dacani, Immunoblot IgG genus positive. Wait a minute. Positive for Babesia dacani, Immunoblot IgG genus. Positive beta-cani, Immunoblot IgM. Oh, okay, I got it. So your dacani Immunoblot IgM was positive. The genus was positive IgG. Okay, I got it. All right. And let's see. Immunoblot IgM and indeterminate band 41, Immunoblot IgG, antibodies B, Borrelia burgdorferi, tick-borne relapsing fever. All right, I don't see where your question is. Oh, here we are. I think it's down here in a minute. Bear with. I want to read back through this again. So it came back positive for dacani. All right, so your testing was not clear for Borrelia and tick-borne relapsing fever. At least that's how I'm interpreting what you wrote here. It wasn't positive or negative, basically. I think I see a second part to your question down here. Let's see. I would like to know, in your opinion, if this can be treated with an herbal protocol or antibiotic protocol or a combo. What herb or antibiotics would you use? I'm getting mixed information. Some say because it's beta-cani, it needs to be treated with antibiotics. What herbs or antibiotics would you use? I have most of the symptoms: fatigue, shortness of breath, joint pain, muscle aches, memory, brain fog. Any information would be great. Okay. So first of all, I'll focus on the Babesia side. Your testing for tick-borne relapsing fever and Borrelia, based on what you wrote there, I'm interpreting as indeterminate. I can't tell whether you have those or not. It is possible, even with negative testing, you could have those other tick-borne infections as well. And to help me figure that out, I would need to ask you a bunch of questions back and forth to see if clinically, if it looks like you have those other infections. Okay. But to answer your question just about Babesia, so you could treat your Babesia either herbally, or you could treat your Babesia with prescriptions, or you can do a mix, okay? In terms of the success rates that I saw in my practice, and even with Babesia dacani, prescription options will generally work about 80 to 85% of the time. Any first combination that you get put on will work about 80 to 85% of the time. And if you have to change to a different combination, they have a chance of working about 80 to 85% of the time as well, too. Okay. Herbal options, I find to work, any one or two that you go on, I find to have a chance of working about 80% of the time. Okay. So you have a slight less chance of benefit on herbal, but they can still work about 80% of the time. All right. If you go herbal, I usually will start a person on Cryptolepis first, and I usually will try to work them up to 5 milliliters, which is a teaspoon 3 times a day. If within 2 months of starting somebody on Cryptolepis, I'm not seeing them get any better, then I want to add artemisinin to that. And the way that I dose my artemisinin is as a 100 milligram pill. And I'll have a person usually start at 2 pills 3 times a day for 3 days in a row. And then I'll have them off for 11 days. So I pulse my artemisinin. And then if they tolerate that dose, the next time I go up to 300 milligrams 3 times a day. Then the next round I go up to 400 milligrams 3 times a day. And for larger people above 150 milligrams, I might even go up to 500 milligrams 3 times a day. And again, that's 3 days on, 11 days off. Okay. Now, the reason I pulse my artemisinin is the liver has enzymes that can develop, or the liver develops enzymes that can deactivate the artemisinin. So if you pulse on and off that way, you hit somebody hard with a high dose to get a great killing. and then you back off to let the liver reset, basically. And it's a way that the Chinese have used to treat malaria that seems to work out really well in the world of Babesia as well, too. All right. Now, the other option, if you want to go an herb and a prescription, you could do like a Malarone, which has two drugs in it, something called atovaquone and proquinil, and you could couple those with cryptolepis. I've done that before with people. Or you can go all prescription. And usually where I like to start with my prescription protocols is to go to something called Malarone along with clarithromycin. But if somebody's not getting much benefit within a couple months, I might look at what are called quinoline options, which can either involve using primaquine or tafenoquine, and I'll go that direction. Okay, so now whatever you try, you want to give it about 2 months to see if it's giving you benefit. And what you need to do is look and see, are you at 2 months, by the first 1 or 2 months, you should be starting to see some decreasing in your Babesia symptoms, especially air hunger, which is the shortness of breath, and some of the fatigue. Those kind of things should start lifting. Doesn't mean they're gone, but they should start lifting. And if by 2 months they're not, then you want to look at a second regimen. Okay. So if you're on crypto and you're not getting better by 2 months, then add in the artemisinin, for instance. Okay. All right. So let me just do a quick screen share here for you. Okay. So in my Lyme guide, take a look at the infection treatment plan section here and look at my Kills Babesia guide down here. And in here, I talk about the steps you should take. And I mentioned from a prescription standpoint, there's what are called atovaquone-based treatments. And so that would be the Malarone I was telling you about, okay? And then there are what are called quinoline-based treatments, which would be that tafenoquine, primaquine. And I talked to you about how you would build a treatment using one of those here, okay? I also talk about the herbs, the cryptolepis and the artemisinin, and how you would wind up building a treatment with both of those here. And finally, there's another option, which is to use a combination of something called cryptolepis, Sida acuta, and Lacornia. Okay, all right. Now, there's some recent research that came out that's starting to expand our understanding of how a lot of these herbal antibiotics work. And I want to show you, if you want more explanation of herbal antibiotic possibilities to treat any of the tick-borne infections, take a look at this article I just produced a couple weeks ago, which is called Best Herbal Antibiotic Plans for Lyme, Bartonella, and Babesia, where I review a lot of options in that article as well, too. Okay? All right. All right, Peggy. I hope that gives you some useful information. Good luck to you. Let's see here. Hello, Veronica. See, hi, Dr. Ross. I was wondering if a linea nitoxinide is good for combating Bartonella. If so, which kind of Bartonella does it target? So no, I don't think it is. Now, when but I want to make sure you wrote what you meant. Okay, so you also say here you're wondering what does it target, and then you said spirochete, intracellular, and cyst forms. So Bartonella does not have forms. The Bartonella just lives in one way, and then it lives inside of cells. Borrelia, which is Lyme, is the one that has spirochetes, an intracellular form, and cyst forms. Okay, so if you meant Borrelia, what I would tell you is my experience working with the linea showed that it did not really give much benefit at all. Okay, I think there's far better antibiotics to use. There is only one study that anyone has ever done looking at using Alinea, but it was used as part of, I think, a 2 or 3 drug combination to see if it would help with persisters. And in that format, it did, but no one's done studies that look at Alinea alone to see if it kills anything, to be quite honest with you. Clinically, I never found it to be that useful. All right. Sorry about that. All right. Good luck to you, Veronica. Hello, Kelly. Let's see. Hi, Dr. Ross. What are the main side effects of methylene blue apart from those related to G6PD deficiency? And is it safe to use for someone who has C. diff? Good question. All right. So everyone, hold on here just a minute. All right. So methylene blue, everyone, is a drug that has been repurposed as an antibiotic. All right. So it is actually a clothing dye. And so, for instance, you can buy it online if you wanted to in your own powder and mix it up. The trouble with those sources, if you think about you're doing that, is whether they can verify that it's free of heavy metals and other toxins. And a lot of times they can't. Okay. So generally, if you're going to do methylene blue, it probably needs to be made up by a compounding pharmacy. So I just want to say that. I know you can buy it online, but boy, I don't know if I would trust those powder sources. Okay. All right. So anyhow, methylene blue is approved as a drug to treat a medical condition called methemoglobinemia, which is a condition where the hemoglobin that carries oxygen within your red blood cells, and some people with this condition, their hemoglobin, when they get under stressful states, doesn't let go of the oxygen, right? So they become oxygen starved in their tissues. And what we do in those situations when they come in all blue to the emergency room and we figure out it's methemoglobinemia is we give them an intravenous injection of methylene blue, pharmacy grade. And what it effectively does is it results in the release of the oxygen and they get out of their hypoxic, low oxygen crises. Okay, so that's the main purpose of it. There are laboratory studies now that tell us that it is antimicrobial against Bartonella and Borrelia and is useful in both situations for treating persisters. On the Bartonella side, there's also evidence in a lab that they will treat growing forms. There's no one that has done in a lab to see if it will treat growing Borrelia, but based on my experience and how it works, I think it does. Okay. So the lab evidence says definitely persisters for Bartonella and Borrelia based on lab experiments. Lab experiments say it definitely goes after growing Bartonella, but we don't have solid lab evidence that it goes after growing Lyme, but based on using it and how it behaves, I think it does. Okay. All right. Now, when you use G6PD, the one thing you have to worry about is a condition called G6PD deficiency, which Kelly writes about here. And that if you have low levels of this this enzyme called G6PD in your red blood cells, and you take methylene blue, you can have rupture of your red blood cells. You want to just do a G6PD test to make sure you have enough of it. All right. All right. Short of that, the other side effects are it stains everything blue. All right. So if you use it, you'll see even your porcelain toilets, it is hard to get that stuff out. You can, but it just happens to be hard to get it out. All right. The other major issues I see with patients are bladder irritability. There is a certain group of people, as you get into higher doses especially, you'll start getting some bladder irritation, either burning on urination or a need to urinate frequency I have seen. And one of the things you can do if that happens is you can get the over-the-counter bladder infection medicine called Pyridium. Pyridium is kind of like an aspirin for your bladder, and you can use that to help settle your bladder down, okay? There is an occasional person that I have seen get GI disturbances where they'll have diarrhea or bloating on it. But generally, the most common side effect I see is it turns everything blue and the bladder irritation. Other than that, there are just not very frequent side effects that I see on it. Okay. All right. All right. Then, so the way that we think it works, we think it is not working like a classic antibiotic. What we think it does is it gets into the cell membrane of the germ and destabilizes it. Okay. So I used to think, because of that mechanism, that probably it would not do much to the bacteria in the intestinal tract. More recently, I have seen a presentation by a gastroenterologist researcher called Sabine Hazan, who has got some laboratory evidence that she thinks that the methylene blue can decrease populations of something called bifidobacterium. And bifidobacterium is one of the cornerstone bacteria of your intestines and help it operate correctly. So knowing that, I don't think I would use it with C. diff because I would be concerned it might knock down some of your good bacteria, like the bifidobacterium in your intestines, allowing C. diff to grow more. Okay. So everyone, C. diff stands for Clostridium difficile. It's a bacteria that normally lives in everybody's intestines. When you're on antibiotics, believe it or not, it's one of those rare bacteria that can grow too much. And when it does, it releases a toxin that gives you bad diarrhea. So I don't think I would use it until you get your C. diff under control. And by that, I mean, you have no evidence of C. diff being active in you again. And what I mean is you no longer have elevated C. diff toxin levels. Okay. All right. Now be careful, because there's some of these labs out there that doctors are using. I use them too, that like a GI map or Genova Diagnostics, GI Health Effects, that will look and measure levels of certain bacteria in your intestines, including C. diff. And they'll give you a report that says you've got elevated levels of C. diff. Well, it lives in our intestines naturally. What you're worried about is you have such an elevation that it's actually leading to toxin production, giving you diarrhea. So if you have C. diff showing up on a Genova test or a doctor's data GI test or on a GI map, and it says you've got elevated levels, but you don't have any diarrhea and you don't have elevated C. diff toxin, then I wouldn't worry about it. I would use your methylene blue, okay? But if you have an elevated C. diff showing up on one of these tests and somebody thought, I wonder if it's a problem, I'm going to do a C. diff toxin blood test, a stool test looking at C. diff toxin. And if that came back normal, then in that case, I would also use methylene blue. But if you have a situation where your C. diff toxin is elevated, I probably would not. Okay. All right. And then in terms of some things, natural things you can do to help with C. diff, one of those is to take spore-forming probiotics like a megaspore biotic. Spore-forming probiotics like Megaspore have the ability to rebalance the good and bad bacteria in your intestines without actually populating your intestines. All right. You might do like a couple pills one time a day. And in addition, the probiotic called Saccharomyces boulardii, also called Saccharo B for short, is a healthy yeast that lives in our intestines, not Candida yeast, but another type of yeast. And it has been shown to actually help treat C. difficile. And so usually I have people do 2 pills one time a day of that, and then even continue it once I put them back on antibiotics to help prevent C. diff from occurring again, and probably do the same thing with the Megaspore biotic as well too. Okay. All right. That's a lot of stuff. Let me look at one other thing. I can do a screen share here. Thank you for that question. Good luck to you too. Let's see here. All right, let's see. So I've got a whole article on methylene blue, and I just want to see if I forgot some other side effect here. I think I have it down here. There it is. Let me see here. Yeah, so side effects, I said, turns everything blue, can give some intestinal cramping, and the bladder irritation. So these are the main ones that I wrote about here. They are the main ones. Okay, so I didn't forget to tell you something. All right. And then in terms of the Sacro-B, this is a thorn product I would recommend, okay, for people that have C. diff with toxins, okay. And then in terms of the megaspore, this is the megaspore biotic that I was telling you about, okay. All right. All right. Thanks for the question. Good luck to you. Hello, Bob. Let's see how Dr. Ross. I've been diagnosed, tested positive for Babesia, and have looked at adding in some lumbar kinase to break up fibrin nest. However, I'm struggling to take Lumbro, and I was wondering if there's an acceptable alternative. Excuse me here. There is. Just hold on a minute. All right. So what Bob is writing about, there's for Babesia, there are what are called sequestering strains of Babesia. And the main one is something called Babesia oticoli. Okay. It isn't. I know that there's Dr. Harry Lindner has been talking about and writing a lot about Babesia oticoli. And if you happen to come across this stuff, you would think everyone's got Babesia oticoli. There still is a large debate going on about how prevalent it is. He thinks everyone that's sick with Babesia that's not getting better is oticoli. But if we look at samples that are hitting most of the labs, these labs that will screen for all kinds of Babesia oticoli, it doesn't look like the lab experience is showing that, okay? Of the Babesia strains, the only one we really do know to be a sequestering strain that will wrap itself up in your blood clotting protein called fibrin, and then in these Babesia fibrin nests, stick itself on your blood vessel walls and be hard to get antibiotics at or for your immune system to reach. The only one probably is oticoli. There's no evidence that happens in Decani, and there's no evidence that it happens in Babesia microti. Okay. All right. So I just want to say that not everyone has a sequestering strain of Babesia, but it is worth trying a lumbar kinase to see if it'll make a difference if you don't know what your strain is, because it could be you are one of those rarer people that have oticoli. All right. All right. So lumbar kinase is a group of enzymes that are made in the skin of earthworms, and they're great at breaking up fibrin. They're probably the strongest herbal way we have of breaking up fibrin. Another enzyme that can break up fibrin is nattokinase, and it's probably about 100 times weaker. Okay. Now, if you're struggling to take the lumbar kinase because of a timing issue, you're going to have the same timing issue with the nattokinase, and that is that both of these enzymes need to be taken on an empty stomach, because if you take them with other things other than water, if you take them with food, if you take them with other medicines or supplements, they may break those down and not get absorbed to take care of your fibrin. Okay. All right. So if the issue is a timing issue, I can't help you by switching over to nattokinase. If your issue is that lumbar kinase is causing too severe of a Herx for you, then yes, switching over to lumbar kinase, which is about 100 times less strong, may make it easier for you to get into treatment, okay? And if you happen to have side effects on the lumbar kinase like nausea, the nattokinase may not do that as much. And then finally, If your issue of timing is you just can't get it in twice a day, I have still found benefit. Instead of giving it one pill twice a day, I might just have a person take 2 pills all at once. Okay. And sometimes that makes it easier to be able to use timing to get it in for you as well too. Okay. All right. Good luck to you. Hello, Veronica. Let's see. Hi, Dr. Ross. If you have a positive result for Lyme in addition to a positive result for Epstein-Barr, then it could be possible that you do not have Lyme and the EBV is mimicking it. Good question. So yes, that is possible. So chronic Epstein-Barr virus in some people can reactivate and come out of hiding and become a condition that produces a lot of cytokines, okay? In my experience, all right, so let me talk a little bit more about that. So there's a group of viruses, of which Epstein-Barr is one, something called cytomegalovirus, also called CMV, is another type of herpes virus, not sexual herpes, but a respiratory herpes called HHV6 and HHV8, something called parvovirus B19. These are all viruses that once you get them, your immune system probably doesn't get rid of them, but it puts it under control. And we cohabitate and we live with these viruses in us in what's known as a latent or inactive state, because our immune system is doing what we want it to do, which is keeping them under control. Okay. Now, when you get some other infections like COVID, for instance, or tick-borne infections, it is possible, as your immune system is dealing with those problems, that it allows it to take its eyes off of controlling the Epstein-Barr, and the Epstein-Barr can become active and then trigger a condition that looks exactly like Lyme because it's triggering all the cytokines. All right. In my experience, when I have, what you'll find is in my protocol, my Ross Lyme support protocol, I called for treating your tick-borne infections first. And if you're not getting better by 9 to 12 months, come back and look and see if it might be Epstein-Barr that's doing it. All right. The problem with Epstein-Barr testing is mostly what we have is antibody testing. And even if you get elevated antibodies, that doesn't mean your immune system lost the battle. It just means it's working harder to keep those germs under control. At one time in my practice, I would treat Epstein-Barr first before turning my attention to the tick-borne infections, and I never found much benefit for treating it. And in general, even when I decide I'm going to treat it at about 9 months to a year, if somebody's not getting better, I rarely find benefit for treating it. I honestly think for most people that Epstein-Barr is not the problem. I think that for most people, our immune systems keep it under control, to be quite honest with you. But you do raise an interesting question. And there's no way to really tell. I try to take a history. So if somebody, came to see me and they said, I was doing great till I got my tick bite, then I'm probably going to think it's probably Lyme and not reactivated Epstein-Barr. But if it's somebody that, was doing well and suddenly started getting sick, and as part of testing, they discovered Lyme, not with a history of a tick bite, and they also discovered Epstein-Barr, historically, I have found better benefit still in treating for Lyme rather than going after the Epstein-Barr. Okay. All right. Good luck to you, Veronica. Thanks for the question. Hello, Claire. Oh, wait a minute. These glasses are driving me nuts here. They're more comfortable. The trouble with these glasses is I have no magnification up here. It's all down here. So now you're going to see me tipping my head up to read the questions. Let's see. Is IGenex a company that does test? We use Vibrant, MDL, and seem to get different results. All right. So IGenex is probably the best lab that is doing testing. And it's best because it is the most accurate and it is the most validated. All right. So when independent labs like Vibrant and IGenex develop labs that they don't sell to other companies to use, they don't need Food and Drug Administration approval, and which means they don't have to prove to anyone that their test is accurate. All right. What IGenex has done, fortunately, though, so like when I, as a physician, use one of these independent labs that has a non-FDA approved kit, it doesn't mean it's a bad kit. It just means they don't have to get FDA approval. But as part of their developing their test technique, they should still do some of the equivalent testing that would be required to get FDA approval. They should do what's called validation test. And what you do with the validation test is you take your test and you look and see how accurate it is at determining whether samples have or don't have the illness that you're screening for. So let's say you're testing to see if your Borrelia method is accurate. You get samples of blood from the Centers for Disease Control, of which some of those samples are known to have Lyme in them, and some of them are known to be negative. And you look and see how accurate is your test at picking up the positives and picking up the negatives, and not being false when it picks up either one of those. Okay, that's called a validation test. All labs are supposed to do that, but a lot of them do not. Vibrant has only validated its Borrelia test. It has not validated its Bartonella, Babesia, and other infection tests. So when you get a positive or a negative result out of Vibrant, who the hell knows what it means? They haven't gone through the testing to say they are accurate. Okay, all right. Versus IGenex has. Okay, MDL uses valid testing. The trouble is they don't test for as many strains as what IGenex does. So on the Immunoblot, IGenex looks for Borrelia, for Lyme. They're looking to see if you have antibodies against 8 strains of Lyme that we now know are prevalent here in the United States. Versus MDL, I think, is only looking at 1 or 2 strains. For Bartonella, IGenex, through its Immunoblot method, looks to see if you have antibodies against 4 specific Bartonella strains, and is looking to see if you have antibodies against the family of Bartonella, which includes 11 members that can give you Bartonella infection too. Versus MDL, I believe, is only looking for 2 strains. Okay. Anyhow, I can go through that for every test. IGenex has done the work to validate and test for more strains, and that's why it's better. It's more expensive, but if you're really trying to figure out whether you're going to be subjected to years of antibiotics or not need to be subjected to it, it kind of helps to have that testing under your belt. Okay? All right. Good luck to you. Joel, Joel Smith, I see a question from you here, but it's incomplete. There's nothing here for me to answer, so I'm going to just move on. Sorry about that. Hello, Gene. Let's see here. Hello, Marty. Thank you so much for this conversation. You're welcome. When I take no antibiotics or herbs, I can't read this. I have to go back to my glasses that are hurting my nose. Just a minute here. Let's see. Hello, Marty. Thank you so much for this conversation. When I take no antibiotics or herbs, my health is fine in the summer. However, I get persistent, debilitating sinus infections and a tight neck and headaches all winter, and spend most of the time in bed. I have a Lyme diagnosis for decades, and whenever I've treated the Lyme with herbs or antibiotics, I get so tired and heavy and can't get out of bed. I also get severe headaches, neck tightness, joint pain, and strong neurologic symptoms of numbness and tingling my arms and the legs and face. The symptoms were so severe I stopped antibiotics. I've just completed 5 months of Japanese knotweed and cinnamon for 5 months, had joint pain, extreme fatigue the whole time, but they never really improved over the time. I'm thinking I have tick-borne illnesses and am super sensitive to treatment. What could be going on in my body? What do you recommend I do? I'm thinking I might try super small doses as you've written about. All right, let's see here. All right, so I'm going to step back for a minute here. So I do understand when you're using antibiotics or herbal antibiotics that treat for Borrelia, you get worse, which would suggest that, yeah, you've got those germs in you, you're having Herx reactions. But you also wrote here that in the summertime, your health is fine. All right. So what that suggests to me is maybe your immune system has got the tick-borne infections under control. You also wrote, though, that you get everything falls apart in the winter. And that you get a lot of sinus infections, neck and headaches all winter, right? So what I wonder is what's different about your home environment in summer versus the winter? Do you change homes? Do you have a different beach home you go to in the summer? I hope we would all be that lucky, where most of us are not, but do you have a different home you live in the summer? Because if it could be environmental, which is you might, in a more closed-in environment in the winter versus the summer, let's say if you happen to have mold in your home, there's two reactions you can have to mold. One is you can have toxin buildup, and only 25% of us have that problem. But the bigger problem that most people have with mold in our walls and in our ceilings is that if it's in the mold and if it's in the walls and the ceilings, a lot of us can have allergic reaction. And that allergic reaction can result in nasal congestion and blockage of normal flow within the sinuses, which then allows bacteria to set up. So when I hear a problem like you're having, which is seasonal, I'm wondering what's going on in that house that either when it's more closed up in the winter is causing a problem, which often can be mold and mold allergies, resulting in making it easier for you to get infections and all the debilitating problems you have in the winter. Or, and especially if you're moving, let's say if you happen to have a better home you're in the summer and you go into a different home in the winter, I mean, that's obvious, right? But I would, before thinking you necessarily need to be on Lyme antibiotics, it may be possible your immune system's got it all under control and that you're killing something you don't necessarily need to kill, that maybe this is more of an allergy mold problem resulting in ultimately developing sinus infections, and that's what the underlying problem is. I would go back and look at your home environment. That's my thought on this, okay? You may have done that already, but those would be some things I would think about, okay? All right. Good luck to you, Gene. Let's see. Dawn started to write a question, then stopped and said she's having a hard time getting her thoughts together. So anyhow, thanks for trying, Dawn. I appreciate that. Hello, Rio. Let's see. Blessings, Dr. Ross. I was hospitalized because of a life-threatening salt level drop due to either Borrelia, Bartonella, or the Babesia parasite. Do you know which infection could cause this? Also, the CCD doctor kept asking my wife why there were dead Babesia oticoli parasites. Well, she did use a Rife-like machine and ivermectin before I went to the ER. We have ordered the Baluchi lumbricanase for the Babesia eggs that appear to be in his liver. What would you use besides the machine to kill eggs that get exposed from the fibrin? He's very healthy with no issues. So to clarify, to answer some of this, and there's some parts I'm not going to be able to answer just because I need to ask you a lot more questions, but In terms of low salt levels, I have not found any of the tick-borne infections to lead to that, okay? Now, one of the things that's common in older people that can lead to low salt levels is if you happen to be overhydrating, if you drink too much water relative to what you're able to pee out. So he may want to, and the doctors, in terms of some of the testing that they did in the hospital, should have been able to tell based on that testing whether he was overhydrated or not. And if so, then the trick is just not having as much fluid in the future, okay? In terms of Babesia eggs, it's not Babesia eggs that we're necessarily treating with the Baluchi. What we're doing with Baluchi is we're using it to remove fibrin that attaches itself to the Babesia oticoli parasites, all right? Ivermectin may have some antibabesial properties, and so could have resulted in some of that killing. Rife machines may or may not. They seem to help about 40% of the time. But the purpose of the lumbar kinase is to rip these nests, these fibrin pieces off of the Babesia to expose it better to the immune system and to the antiparasites like an ivermectin, for instance, okay? All right. So anyhow, those are just some thoughts I have. I know you tried to ask me some more specific questions, but I would need to do a give and take with you here that we can't, okay? All right. Good luck to you. Good luck to your husband. Let's see here. Hello, Bob. Let's see here. Speaking of low-dose naltrexone, I have tried it several times and it seems to activate another problem I run into. That being, it causes my feet, skin to burn and or become hypersensitive. Other things cause this effect as well, but have had no success in figuring out why this happens. Any suggestions? I am treating for Lyme Babesia, but this burning feet issue just complicates my treatment options. So burning feet means nerve injury, basically. It's a symptom of neuropathy. I am not clear why the low-dose naltrexone would make that come up more. But the underlying thing would be, why do you have the neuropathy? All right. So neuropathy can be part of tick-borne infections. It can be part of toxicity. It can be part of thyroid problem. It can be part of getting too much B6, not getting enough B6. There's some basic blood testing you should do to look for it. I'll show you an article about that here in a minute. And then also there's some basic repair things you can do involving glutathione, involving repairing the membrane of your nerves and the mitochondria in them, and also using a peptide called BPC-157. The reason I'm moving through this quickly is I don't have enough time to go through it in depth because it's already 7:29. I'm going to show you the article, though, that has all of this in detail, along with a video of me in it as well, too. Okay, so let me do a screen share here for you. All right, so take a look at, go into my online Lyme guide here and click on the latest button over here. And here is my peripheral neuropathy evaluation and repair article. Okay. All right. Now, while we're here, I just wanted to let everyone know. So I know if you think you're getting benefit from my Ask Marty or my conversations with Marty Ross MD, you're probably going to get more if you become a member of my membership group called Lyme United. Okay. And so this is what it looks like. It's basically the kind of a Facebook page, except I run it on a different platform. And in here, we have a number of forums that we can interact together. There's a forum where people say hi, welcome, introduce themselves. The big two thing, there's three big things though. Number one, our members have their open forum where they talk to each other. There is a forum called Office Hours with Marty Ross MD, where people write to me questions daily, and I spend an hour each day writing back responses. And then there is a Zoom room forum called Ask Marty Ross MD Live, where once a week we talk on Zoom, and I get to ask follow-up questions, and I get more information to be able to give people ideas. Anyhow, you may want to take a look at this. If you're finding benefit from my conversations, I have room for new members here, and I'm always looking for new members. If you want to look a little bit further at this, take a look at my Lyme United page at Treat Lyme. I describe more about what to expect here. There's even a video where I walk you through it. And then I talk, there's people have reviewed us. They've got really good reviews. And then talk about how you wind up signing up. Okay. So I welcome your joining us. I am always looking for new members. The more members we have, the better the group. We get more input from each other, and we all learn and grow together. So come join us. All right. Let's see here. All right, everyone. That's it for tonight. As many of you know, I am going to add another webinar next week. I currently do not have one scheduled for them, but tomorrow morning when you get the email from me announcing that the recording is ready with the summary, you will also see a link to sign up for next week. All right. And please join me at Lyme United. Also, let other people know about Lyme United and let other people know about Ask Marty or Conversations with Marty Ross MD here. So share the email when I send it out tomorrow morning. I'd appreciate that. All right. Good night, everyone.